So nice to speak with you today, Dr. Pizzorno. I thought we could have a really nice conversation about how healthcare has changed over the past few decades, not only in how it's been delivered and how it's available, but how we have control over personal health information. So being an expert in functional medicine, how do you think that these changes have impacted the functional medicine practice?
Well, I've been in medicine now for literally over half a century, and it's changed a lot. I remember in the days when I was first practicing, you had a really close relationship with your patients and it was very much one-on-one. At that point, that'd pay out of pocket anyway, so there wasn't a lot of insurance agents around. So, we just do the best we could for our patients at the least possible cost. But it's changed so much now. So much of medicine is being driven by insurance and by algorithms and by state laws and such that the doctor of today has far fewer choices. So that part's been bad. The good part is patients have more power. And I'm 100% believer in that. Patients have more power. They have more ability to access their own data, and they have more ability to demand of their doctors that they be treated as individuals, not as statistical means. And that's one of the big challenges for conventional medicine, and that's all based on statistical means. And while that's great for things like infections, for everyday health, it's not a very good model. And that's why our medicine exists.
Yeah, I think that's really spot on. As a student and starting to see patients, I've really seen how much people really want that individualized medicine. And frankly, they just want answers to these chronic health conditions that, allopathic medicine just kind of throws pills at or just gives you here's a couple diet recommendations and then see you in a year. But giving people an approach that allows them more individualized care, I think has been one of the guiding impacts functional medicine currently is having on the field, especially just comparing it to the allopathic medical model.
All right. Yeah. I think that's well said. Continue on with that idea of the individual. The more and more the individual wants to be treated as a person, the less and less they're willing to be just treated as a disease. And so as they start asking them questions from the doctor, the poor doctors who are extremely well trained in what they do become pretty frustrated because the patients are asking questions that they weren't taught. They were taught these really good algorithms that were great in some situations, but for everyday medicine, for everyday people are individual, they're unique. They don't fit into these simple algorithms. One of the benefits of our medicine is that I think what we do and what might be called health medicine by whatever name, we've got a really important role to play here. And that's one reason why I'm involved with functional medicine is because right now, functional medicine is the strongest organization in this field advancing health medicine. And I feel very strongly about the importance of our mission and what we do. And why I'm so delighted that really smart people like you and the youngsters coming along are, interested in this and look into what it can mean.
Yeah. I sort of got involved with this field. I went to undergrad in Vermont and studied philosophy and sociology, and I really loved learning about people, how they live, and then what does this all mean? This, broader scope to things. And then through that, I got into organic farming, running the student farm there, and we had 3 acres. We had draft horses, the whole thing. We had a student-run CSA, and I started working at the local co-op doing herbs and supplements, and was just like, this is the life. I can work with the circle of life. I have people coming and seeking natural ways to help boost their lifestyle. And I sort of thinking like, what's next? What are my next steps? And then taking some of those medical sociology classes, I realized conventional medicine training isn't going to give me everything that I want in order to alleviate pain in, all aspects of life, not just end of life. And in Vermont, the culture there is a little bit more open to all different types of medicine. And a lot of people saw integrative doctors, naturopathic doctors, functional medicine doctors, and So that was sort of already in the culture. And then I realized, oh, like, how do I do that? How do I combine medicine that talks about organic food, talks about lifestyle, talks about taking time to go jump into a stream and have that cold water rejuvenate you, using science-based supplements and alternatives to just what the conventional mainstream kind of tells you to do. I was like, there's more, it's here, how do I get there? And then seeing, how the epidemic of chronic health diseases and how much that accounts for so many of our healthcare costs, how can we reverse that trend so that way we're not such a population filled with chronic disease, but people can just live happier, longer lives. So yeah, I was very, very excited that, oh, there's other like-minded people that think like this. It's not just, little bubbles of people. It's really, there's so many organizations like IFM that's really working on educating other practitioners to think this way.
That's so inspirational. Thank you. That was just wonderful, wonderful to hear. So way back when I was in private practice in the late 70s, it turned out a big chunk of my practice came from Port Townsend, and they're one of the boat building capitals of the world in terms of wood boats and fiberglass boats. Okay. So I see a lot of patients come to see me and they'd have toxicity. And it wasn't bad enough for them to go into OSHA, but it was bad enough for I could see it was damaging their health. So I helped them take care of it. And so I would see people with various toxin problems, but it was virtually always pretty obvious, industrial exposure or choices they were making with their own lifestyle, et cetera. But then as years progressed, I started seeing something very different. And that was, rather than active choices people were making, which result in high body burden of toxins, it was actually the environment was getting fuller and fuller and fuller of toxins. So once you start recognizing that and start look at the research, there's a huge amount of research showing the environmental toxins causing chronic disease.
Yeah, it's that overloaded body burden. And then when your body's spending so much energy, trying to, biotransform and detox all of these toxicants out of your body, you then have a lowered immune response, and then bam, you have all these other chronic diseases. How are, I guess, speaking of like diabetes, specifically with water and kind of with the project that we're working on, where are some ways in which, our medicine can really help here?
So since a lot of the chronic disease people are experiencing is, in my opinion, right now, more due to environmental toxins than nutritional deficiencies. And I want to be real clear. I'm not saying nutritional deficiencies don't exist, because they certainly do, but it's just being overwhelmed by even worse problem of environmental toxins. So I think it's critical that we help people recognize where the toxins are coming from and ways to avoid them. And when you think about toxins, you think about in two classes, not metals and chemicals, although you can think of that way if you want, but a better way is persistent versus non-persistent. So non-persistent means toxins close enough to something we were exposed to as we evolved as a species, we get rid of it. You can just avoid them and your body load will go down very quickly. But the persistent ones, those are ones that are chemicals, virtually all of the man-made chemicals, not virtually all of them are man-made chemicals that were designed not to be broken down by biological systems. So we don't have any way to get rid of them. So some of these toxins have half-lives. I mean, half-life being how long does it take to get rid of half of it? Well, you know that from your education. Okay. Anyway, some have half-lives range from months to years to decades. So the PCB, some of the PCBs in farm fish take decades for a half-life to get rid of them. So it's like you eat one fish stick of that kind of stuff, and whatever was in that steak, if it was one of those long-term what I call PCBs, it's going to be with you for the rest of your life. It's very scary. Those are much harder to get rid of, and you actually have to engage in active behaviors to get them out of the body because the body can't get rid of them. That's where saunas and things like that are so helpful. And I'm sure Chinese medicine has some things to say about that as well, I think.
Yes, and even with, I did this trip to Germany for hydrotherapy, and how much sauna can impact that, and how many traditional cultures have this already built into their systems. And I think one of the main things with the different types of toxin exposure and, persistent versus non-persistent is this passive determinants of health that you kind of spoke of earlier. So, if so much of these toxicants are coming from air, water, things around us, not even just things that we're eating or things that we're not eating for the deficiencies, these things truly affect the health of an individual. And then when you combine that with any genetic predisposition, it can tell you whether a person will be healthy or not. And so I think it's important to assess these determinants of health because, you know, where we live, the genetics, our income, education level, all of our relationships, these all can have such a big effect on our health beyond just, are we having access to health or are we using healthcare services? Because you can go to a doctor all you want, but then if these things around you stay persistent and the doctor's not seeing that, you know, how are you going to have any effective change? And then that even gets to, you know, getting to the real root of solving these problems in society, which are clearly there, instead of consistently blaming the individual for, oh, you know, you may have obesity, therefore you have diabetes, or you may have X, then Y. There's all these other factors that are involved to get to that Y. And, you know, simply crediting one population or the other population for good health is kind of short-sighted, because you have to take in the health of the environment around them. And due to so many different, you know, societal factors, political factors, all these other factors that determine how a neighborhood is set up, you know, where do all these plants set up, you know, where do these water lines go to, who is controlling all the resources in the area, this really, really affects someone's health. And I think simply just acknowledging that and simply saying, you know, you don't have access to healthy food, you don't have access to healthy water, you're living in a certain area that has been, you know, filled with chemicals for the past 40 years. Once you can just see these social societal factors, then you can really get to the root cause instead of just looking at, you know, this is what you're eating and this is what you're doing. But you have all these other pieces around you that, you know, we are an environment and we're in it. So I really appreciated that emphasis on this part of medicine, because without it, we're just completely missing the mark.
Well, that's so very, very well said.
And, you know, this kind of leads into, you know, we were having these conversations a year ago, a bit of how can we create some impact on the society that obviously needs it. And then we, you know, came together and we're like, let's do something. Let's, you know, we have the power, we have the education, we have the resources. Let's actually impact some change. And then you know, have these wonderful doctors in Flint, Michigan, and it seemed to be the perfect place to implement some change given the history of Flint. And also you're already having a personal relationship with some MDs there.
Well, thank you. So, and thank you for being such inspiration for this. So one of the challenges I've had is I think we're all very, very worried about what's happened to race relationships in the country. And frankly, I don't think either side of the aisle is doing very well in this. So realizing I couldn't affect that, I thought to myself, well, what do I know what to do? What do my friends know what to do? And that is, we know how to promote health. So fortunately, a very kind medical doctor, friend of mine, Dr. Ann Burton in Flint, Michigan. I happen to know her from conferences, and I mentioned this idea to her. She said, well, that's wonderful. She started mentioning to her MD friends there, and they all thought this was a great idea. So I started talking to friends in the natural products industry and saying, hey, there's something important we can do here, folks. You know, we don't have to feel powerless. We can actually do something. And so we're getting donations of free lab tests, free vitamins, financial to support to make this happen. So we're hoping that the great future leaders like Jacquelyn will take this on and use as a model to help educate the rest of the country for how we can make everybody's health better.
I think it's been such a great opportunity, this project, with working with local leaders in Flint. You know, even the mayor is on board with helping us have access to some of the different organizations there. But when you really work in the systems environment, and it's not just, you know, I have all the answers or we're taking this from you, but instead let's all work together with our own field of expertise to help impact the population. Because what else is medicine if you're not, you know, actually helping people and getting it to the people that might have been overlooked, you know, more in the past. And I think that this is kind of leading into another sort of what can we do next? And, you know, it's not just access to care, but it's about having more people do this type of care. So more education of different practitioners, the more, when we do this Flint project and we show that there's some evidence-based outcomes, then you see, oh, wow, this medicine works. You don't need just simply the traditional approach to diabetes. You can do it in another way. And the more we have that, then we begin to increase the care to underserved communities, because you need to have it seen to work for people to believe in it, because that piece is so important with the delivery of the medicine.
Very well said. What most impressed me was the community taking on themselves to make sure they had safe water. And I thought the leadership of the church in doing that was really quite impressive.
Yeah.
And we look at these things, we're looking at not just the active determinants of health, but the passive determinants of health. But including that passive determinant of health is what are the social expectations. Getting the community behind this is I think, powerful.
What do you see for the future of functional medicine, naturopathic medicine, what do you see as the future? Like, where are we going from here? You've been one of the pioneers to lead us to this point. So what is next?
Oh, thanks. Always happy to talk about what I think the future should be. So let me say what I think an optimal healthcare system is. I think it rests on three stool legs. One is preventive medicine. I mean, let's be honest. All healthcare professionals, be honest. The vast majority of improvement in human health and morbidity and disease burden and death is basically clean up the water supply and the food supply so people don't die as babies from infection. So it's save more lives than all the other medicine combined. Okay. So we got to continue to public health, but public health to be more than simply contagion control. How about public health that says, farmers, the standard for your food is it's got to have all the right nutrients in it and it can't be full of toxins. Okay. How about that as the standard for public health? Is there anything better example? So you start doing that right there, disease starts dropping off dramatically. And then primary care should be primarily a combination of, I'm biased, of course, today's naturopathic doctor and family practice doctor with some Chinese medicine and chiropractic medicine thrown in. That's my own bias. Okay, more Western bias. Okay. Yeah. Anyway, so we put those in. That's where the primary care happens, because that primary care not only diagnosing and treating the acute disease, but teaching the person why they have that disease, how to live their lives better so it doesn't happen again. So the children don't get it. Okay, just start a health pathway. And then we have the third still is the interventionist medicine. We need that. Okay, you got dumb old people like me riding motorcycles around town. Okay, someone's run into things, get banged up. We need the emergency room. Okay. Yeah. People have rampant infections. I mean, there's all the kind of areas where conventional medicine is really good, and eventually the body does break down. Okay, so you need those high-tech interventions, but they're at the third stage: preventive medicine, real primary care, and then the third deeper care. We need it, but a lot less need for it.
Yeah, I'm definitely really inspired by all the work that you've done, and the work of all the clinicians that have already helped bring medicine to where it is today. So that way, I graduate in a couple of months, I can begin my journey to help others to, get to the root cause of disease, empowering patients to be educated about their bodies, and then, be a part of demonstrating the outcomes that are possible with this medicine. And the more that is seen, the more it is clear how beneficial this medicine is, the more access to care people will have. And I think that is a huge goal of mine, is just how can we increase access and exposure to this medicine? Because, if our whole motto is do no harm, then inherently that should mean getting to the root cause of disease, because that is how you truly do no harm, is to prevent harm from happening in the first place.
One of the things that really excite me about your presence as a future leader is that you came from the ground up. I mean, literally, you came from the ground up. Whereas I came at it totally intellectually. Okay, there's nothing in my background that would have said I go this direction. Although I did learn that my great grandfather was the herbalist in Italy. Okay,
wow.
But I didn't know that until like 20 years ago. Okay, so I had no impact on my history. But anyway, so maybe there's something, I got to just say there's something in the genes. Anyway, but the fact you came from the ground up, you could see the difference. See, I had to go back, I had to teach myself organic farming because I didn't learn that. Okay. And so it's great that you're doing
And I have a beautiful garden. So I actually remember so specifically when I was, I'm sure you've heard of WWOOFing, which is Worldwide Organization of Organic Farms, where you can go and live on different farms. And this was my first experience. 18 in between college. Most kids go home and just have fun. And I was like, I'm going to go live on a farm. And so I find this farm. Turns out to be a biodynamic organic farm, which is just such a cool experience to be able to go live on in a cabin. And I'd had organic food before, but I hadn't really known the real difference between, heirloom and all of that. And so there was this tomato hothouse. So like, where all the, starter plants are going to go. And as I got bigger, you really get to see the beautiful different colors, the purple Cherokee tomatoes. And then my absolute favorite, this was a life-changing moment, was when she's like, oh, you have to try these green zebra tomatoes, which are these little salad tomatoes, about the size of a golf ball. And they have little stripes on them. They're green. They look like they're not totally ripe, but they are. And she's like, just slice it in half and pop it in your mouth, and you'll truly, really understand the difference between supermarket tomato and heirloom biodynamic organic tomato. And I like have actual chills thinking about this moment, because it was really when it's, you wake up, like you get that light going through your body and you really feel, wow, this is what real nutrients are. Like your body knows immediately.
So Jacquelyn, great talking with you. And also, I really enjoyed learning more about your background and your tomato story. I had exactly the same experience eating the plums from my tree. Nobody else liked the plums. I ate that plum and my body lit up and I said, that plum's got something that my body needs. Okay. So thank you. It's wonderful to be reconnected with why we do this.
Yeah. And again, it's you really paved the way for, future clinicians like me to really take what has already been set down and take the research that's been done and the education that's been brought forth and really keep going with it. This is a journey. This is, I'm hopping on the train and I'm ready to go. So thanks for all the work you've done in this field. So I'm really excited.
Fantastic. Thank you.
Yeah.